Hello everyone, my name is Lillian Saad, and today I'll be talking about the impacts of FAD diets on dietary hormones, appetite control, and its relation to chronic kidney disease. The questions I thought were important to research were, can FAD diets have a negative impact on ghrelin production? And are ghrelin levels in plasma related to the symptoms of chronic kidney disease? In this video, I'll be talking about the background information, in which I'll be talking about the biological relationship between diets and the gut hormone. Next, I'll be talking about the goal and hypothesis of the video. Third, I'll be talking about the evidence, after in which I'll be talking about the conclusion, and then I'll be giving some of my personal recommendations. So what is the biological relationship between diets and gut hormone? The hormone ghrelin is produced in our guts. It is also known as the hunger hormone. It influences food intake, fat deposition, and growth hormone releases. Gut hormones in general play an important role in long-term weight loss. These levels increase before and decrease after meals. It also regulates the homeostasis of glucose by regulating glucogenesis and glycogenolysis. It also is important in terms of bone formation, regulations of body symptoms, and metabolism. Ghrelin signals play important roles in dieting and in the effects of chronic diseases. On the right-hand side of this PowerPoint, you can see the control of food intake and its importance of energy balance in the body. So what is chronic kidney disease? This is when a disease or a condition impairs the function of one's kidneys. On the right-hand side, you can see some of the underlying causes include diabetes, high blood pressure, obesity, age. Genetics can also be a huge factor. Symptoms include nausea, vomiting, and loss of appetite. I also have listed the stages of chronic kidney disease. As the stages go on, treatment changes within each step. Various medications are used, and towards the end stage, stage 5, as failure is increasing in the kidneys, transplants and dialysis is the best treatment option at that time. So the goal of my video is to explain that having too high or low levels of ghrelin is not necessary when trying to lose weight. Consuming a balanced diet, as I listed in my recommendations, are important to regulating a balanced ghrelin plasma count in the body. Having too high or low levels can do more harm than good. The disturbance of ghrelin circulation plays a role in eating disorders that affects patients with chronic kidney diseases. When taking part in FAD diets or extreme calorie restrictions, one's ghrelin levels increase, and food cravings also increase. People who are obese tend to have lower ghrelin levels, while individuals who are more restrictive with their calorie intake have higher ghrelin levels. High levels are present in individuals with eating disorders and chronic kidney disease. Ghrelin works as a signal to let your brain know when it is ready to eat. Having high levels or low levels of ghrelin are not necessarily good, as I mentioned before. Ghrelin levels can cause one to be more tired and have excessive weakness. So, how does this affect chronic kidney diseases? Well, we know FAD diets are not entirely energy balanced, which is really harmful for patients with chronic kidney diseases. People with chronic kidney diseases have symptoms of eating disorders. This comes from the symptoms of decreased taste, lack of desire to eat, and etc. Patients that have been going through dialysis have shown to have elevated plasma ghrelin levels. There have been many possibilities for the overproduction of ghrelin in one's body, like the decrease in degradation of ghrelin in the kidneys. The absorption of nutrients may influence these levels as well. Overproduction of ghrelin in organs other than the stomach may contribute to higher plasma concentrations. On the right-hand side, you can see that disturbed glucose homeostasis, growth weight deficit, hormonal dysregulation, and impaired fat metabolism all relate to ghrelin expression in eating disorders like anorexia nervosa. To reduce ghrelin levels in a more healthy and appropriate way would be to eat a fiber-rich diet, getting enough sleep, eating healthy fats, eating enough protein daily, and minimizing stress factors in life. These recommendations can help one feeling more full for longer as well. Improving the appetite of patients in long-term issues like chronic kidney diseases would need to be helped by the regulation of meals, muscle mass, and weight. Studies have been done on mice that have shown that patients with chronic kidney diseases that have had more of a balanced diet have had a decrease in symptoms. So, in conclusion, the concern with this is because of eating disorders like anorexia are important risk factors in mortality in patients with chronic kidney diseases. Increased ghrelin levels have been found in advanced renal failures and fat mass issues in individuals, including children. Finding interventions of this issue can help decrease the mortality rate in chronic kidney disease. Thank you so much for watching my video today. I hope you all have a good day.